Hey mamas, it's Samantha with Strong Beyond Birth, and today I want to talk about Diastasis Rectus Abdominis. It is a condition that I see a lot of mamas have a lot of fear about, and the reason for that is because of some of the terms we've used and how we used to treat it was very limiting. So when we used to talk about it, we would talk about a split in the muscles or a separation of your core. And those things are scary. Yeah, if you're thinking about it that way, you don't want to be using those muscles too much because you don't want to make things worse. But over the last many years, decade plus, there's been more and more research coming out that is sort of changing the way we handle diastasis and changing the way that we look at it. So we have started to shift into this model of thinking about Diastasis Rectus Abdominis as a natural and actually essential part of pregnancy. So as we get more and more stretch in our abdominal wall, that midline, the linea alba, the area between the two walls of the abdominal musculature, starts to stretch. And it has to, right? We have a growing human in there. So it starts to stretch, it starts to get thinned out and stretches. So what we used to look at in the postpartum period was just that midline and like, oh no, you've got a gap. You better not do anything, right? But now we're starting to really understand more about how that is really just one piece of the bigger puzzle. All of the muscles in your abdomen have stretched. Everything has altered, and it really needed to in order for you to be able to carry a baby all the way until it's ready to come out of your belly. So today what I want to talk about is how to assess diastasis on yourself, what to look for when you're exercising, and then how to progress your exercises and how to know when you're doing enough or not doing enough, right? So how to know if you are working too hard, essentially. So the first thing, assessment. Old school, we used to just put you on your back and feel that midline, right? And see how wide the gap was. Now we're really looking at how much tension is occurring in that midline. So you can do this lying on your back for sure. But are we lying on our backs most of the day? I mean, maybe, but very unlikely if you have children. So we want to look at this in a position that is more functional and more applicable to what you do during the day. So wherever you are, if you're sitting or standing, you can feel your midline. So we're going to take 2 or 3 fingers and we're going to feel the area of the abdomen right under the rib cage. So I'm pressing in, I'm feeling how that feels. The area under the rib cage is the most likely to be the closest to your baseline. It's the area that's least affected by pregnancy, although it may still be affected. So feel that area, that's your comparison, right? That's what you're going for. Then we can work our way down. I'm going just right down my midline. I'm feeling for width of the gap. If you're able to feel the 2 muscle bellies, you can sometimes tell, is it 2 fingers or 4 fingers or anything in between. And then as you continue down, you can feel how deep your fingers naturally sink until they meet resistance. So you're testing for how firm, how tense the midline is, right? How strong that tissue in between those 2 muscle bellies actually is just at rest. Then we're going to activate the deep core and we're going to see what changes. So you have your baseline, right? You know how many fingers and you know about how soft it is in comparison to this upper area right under your rib cage. So then we're going to work on some deep abdominal contraction. Now this is where we really need to focus when we're dealing with any kind of postpartum core recovery. This is the foundation. It is the most important piece. And whether you have diastasis or not, we're all going to use this. So I have a handout that I'm going to send to you, and I want you to review it and just practice it. Sometimes it just takes some practice, but we'll go over it right here as well. So we're going to sit nice and tall or stand wherever you are, or lying on your back if that's easiest. And we're gonna take a big breath and let everything fill up and relax. And then as we exhale, we're gonna gently pick up our pelvic floor and gently pull in. You might feel like your lower abdominal muscles are sort of zippering up towards your midline. And we're pulling everything in towards your center. Okay, so we're gonna inhale, let everything go. We're gonna exhale, pick up that pelvic floor, feel that abdominal wall drawing in towards your center. Now, what we're doing here is we're engaging those deep abdominal muscles. Those muscles have muscle fibers that run this way. They run horizontally and at a diagonal. So as we're engaging these muscles, we are actually pulling in from the sides, which, yes, it might make that gap a tiny bit wider, but then go ahead and feel it again. If it's more firm, that's awesome. If it's more firm, you're doing it right. Okay? So that's how to assess. We're looking at rest, and then we're also looking at after you engage that deep core, which, like I said, it might take a little practice. After you engage that deep core, then what does that midline look like? Does it change? Does it get more firm, more tension? So the second thing we're going to address is, what are you looking for? If you are doing that deep core contraction and you look down and you can see that midline kind of bulging out, that might look like a very small little bulge. It might look like the whole abdominal wall is kind of pooching out a little bit. If you feel or if you see any kind of pushing out, you want to feel it. We have to dial in whether that's just excess skin and tissue, or is that actually pressure pushing out against that midline. There is research to show that up to half of women don't actually perform Kegels correctly with just verbal instruction. So this is how you kind of dial in and see if you're doing them well, right? We don't want to see any pushing out. If we're pushing out, you might be actually bearing down and creating more pressure in your abdomen, which is not going to help healing at the midline. So we want to exhale, pull that core in towards your center, and feel all those pieces kind of cinching in around your midline. The muscles that run vertically, that six-pack muscle, the rectus abdominis, that muscle's job is flexion and extension. So that muscle is going to make your spine bend in these directions. That's not what we're doing here. All right, so this deep core is you're going to exhale, it's going to draw in, and your spine stays super tall and long. So, all right, once you've got that, you've assessed, you know what you're looking for that bulging out, that pushing out. You know, some people, we may have just a little extra tissue there. You may see some bulging, but when you feel it, you're pretty firm right under that area, and you can tell it's muscle. In that case, you might be just fine with a little bit of bulging, but we want to be sure that we're using the deep core correctly if you're seeing that and you're just working through it. And for most people, we're going to want to avoid that. But there are some times when it might be a little bit okay, right? If you're strong and you're maintaining that deep core contraction beneath that. What we don't want is that pressurized tension, right? You don't want to feel like, it just feels like an air bubble, right? Or something that is pushing out against you. We want it to be nice and solid. All right, so then the third thing, how do we progress? How do we work through this and make sure we're doing exercises that are suitable to our strength level? So I always say, let's start with just the basics, just activating that deep core. But we don't live in a very, isometric, thoughtful sort of movement way, right? We have to practice functional things. So the next step I would suggest is to try working on your stability. There's evidence to show that rotation is harder for people who have a diastasis, right? So anything we can do to build that stabilizing element of your core is a great thing. So for example, you can do this on your hands and knees, okay? And you can start right here on your hands and knees and then take a big belly breath exhale, pull your core in nice and tight, just like we did in sitting. And again, my spine's not moving. I'm not doing this. I'm not getting all weird. I'm just exhaling. I'm cinching up around my core, and I can even take a hand and feel that tension. If I'm staying tense and tight, that's perfect. Keep going, right? If I'm feeling that bulge or like I'm not really able to maintain that tension here, then this is where you need to stay and keep working on it until you got it. If you've got it and you want to progress a little bit, let's try challenging by keeping your core really steady and then kind of creating a little bit of element of rotation that you're resisting. All right, so typically keeping your trunk really steady but moving your extremities is a good way to do that. So I'm lifting a leg, I'm going to reset my core, pull it all in. I might lift an arm, and I might do both, right? That's putting a lot of rotation. I really do have to be drawing in, and this is one where a lot of people start to break down and like start pooching out their belly after a moment. So if you're noticing that you got it at first, but after a couple reps, it's too hard, you got to back up, maybe just do the first couple of reps and keep practicing. It will get easier. Another good one is lying on your back. This is one that a lot of us know about. It's pretty basic core recovery, but we're going to find that deep abdominal wall, that deep core. You're pulling in all of those pieces. We're not smushing our back into the floor, okay? So maybe tuck your fingers under your low back so you can tell that your spine stays neutral, right? We don't want to put more pressure on our spine. And we're going to exhale, hold on to that deep core while we lift one leg or two legs. We can start with a little march and then progress to a little bit of alternating and holding on to that deep core without tilting your hips back so you're pressing into your hands. We don't want to do that. Pulling in. So again, stable core and moving through the extremities. Okay? So you can kind of do that however you want. Make sure all that midline is staying strong. Progressing, progressing. Yes, you can do planks. Just be watching, noticing where that bulge is. If a full plank is too hard, maybe come to your knees. Maybe elevate your surface. Note, keep checking in. Notice how well you're able to stay with that nice deep core contraction, because we do sometimes break down when we get tired. So back to functional stuff, right? We have been practicing stability on the ground, on hands and knees, in various planks positions and various core type exercises. But what do moms do all day? We pick things up. Babies, car seats, diaper bags, all the things my toddler throws on the floor. So we're constantly bending and squatting and lifting. So that is a really important thing to be looking at. So when you're practicing your tension at your midline, that nice deep core contraction, it's worth your time to take a look at what a squat looks like. So you're going to start standing. You're going to engage your core. You're going to squat down and continue checking that midline, right? And then exhale, pull it all in at the top. Same with bending, okay? So you can bend over. You're still checking the midline. Exhaling, checking the midline all the way back up to the top. So you'll know you're doing too much if you're breaking down. You want to be constantly checking for a little while until you are really confident in your body's ability to manage all of these things. And once you have it down, you're going to be using this all day. You're going to be training your core and healing your diastasis all day long. Sometimes it takes a really long time. Sometimes it's 12 months to a year before that diastasis actually shows visible healing. So don't get frustrated. The midline, like we said earlier, when we're contracting that deep core, you might actually see your gap widen a little bit because those muscles are literally pulling out, right? They're pulling it apart. But what they're doing there is creating the resistance. They're signaling to your body. That tension is signaling to your body that something needs to change. It needs to get stronger in this area. So your body says, oh, we're not quite managing this. We need to send more cells and more structure to this area. So it's going to send some more scaffolding, some tissue repair to this area, and really start to stimulate healing with this tension. So that's why it can take some time. It takes a long time to change tissue. I also want to mention that sometimes things fluctuate, and that can have to do with, inflammation in the gut and bloating and all kinds of things. So if you are hyper focused and checking it every day, and then you notice that it's like a little bit different one day, don't panic. This is about a long-term process. All right, so just continuing to check it on it and manage and kind of working through some of this stuff. So if your gap is 4 fingers or more, I would recommend seeing a physical therapist in person, someone who specializes in postpartum recovery, or pelvic health is usually, they go hand in hand, but not always, but usually. So I would definitely recommend seeing someone in person if your gap is more than 4 or so fingers, or if it is just super soft and you can't generate tension. If those things are kind of where you are, again, don't worry. It just may be that you need a little bit more cueing, or maybe you need some manual soft tissue work and some things to kind of help your body loosen some of those restrictions that can happen during pregnancy. So definitely not anything to worry about, just a good opportunity to go see someone and get some in-person, hands-on kind of help. All right, I hope that was helpful. I have a guide to the deep core, and I want you to look at it and work on it. So if you don't have that, send me a message, send me an email, drop your email in the comments if you're seeing this on Facebook or social media, and I will send it to you. And that's where we all need to be starting. So good luck. Let me know what questions you have, and I'll see you out there, mamas.